Okay, let's dive into this. Welcome to today's Explainer, where we are tackling a deeply fascinating and, quite honestly, a widely misunderstood topic, the spectrum of personality disorders. If you've ever watched a movie or read a sensationalized headline, you've likely seen some highly dramatized stereotypes of these conditions. Well, today, we're going to move right past those media portrayals. We're going to look at the facts, break down the clinical realities, and explore how these incredibly complex conditions actually shape human behavior.
So to start us off, we really need to understand what a personality disorder actually is. Clinically speaking, we define it as a deeply ingrained, rigid pattern of thinking and behaving that significantly interferes with a person's relationships, their work, and their overall emotional well-being. These are not just simple choices. They definitely aren't passing phases, and they certainly aren't just everyday personality traits taken to a slight extreme. Instead, each disorder reflects a highly unique, long-standing interaction of a person's brain chemistry, their emotions, and their life experiences that have developed over many, many years.
To give us a really solid baseline, let's look at this comparison. For most of us, our everyday personality traits provide a pretty stable sense of identity. Sure, we might be a bit stubborn sometimes, or maybe a little shy, but our traits are generally flexible. We can adapt to different situations. A personality disorder, on the other hand, is marked by extreme rigidity. The patterns are so deeply ingrained that the individual genuinely struggles to adapt, which obviously causes major disruptions in their daily life.
Here is our agenda for this explainer. 1. Beyond normal personality traits. 2. Distrust, detachment, and differences. 3. Intense emotions and conflict. 4. Driven by fear and need. And finally, 5. The path to understanding.
Distrust, detachment, and differences. First up is Paranoid Personality Disorder. Imagine walking through life where ordinary, everyday interactions constantly feel like secret threats. That is the reality here. This is a long-standing pattern of deep distrust and suspicion toward other people, even when there's absolutely zero evidence that anyone intends any harm. For someone with paranoid PD, a casual remark from a coworker can literally feel like a direct personal attack. You can imagine how this constant sense of extreme caution becomes incredibly exhausting and makes forming close relationships immensely difficult. And this brilliantly illustrates the distinction between two often confused conditions, schizoid and schizotypal personality disorders. Schizoid personality disorder involves a genuine comfort in isolation. These individuals have very little desire for close relationships. They aren't avoiding people out of fear, they just naturally prefer being alone, and they often display very neutral emotional reactions. Now contrast that with schizotypal personality disorder. Here, we see profound discomfort in close relationships coupled with highly unusual beliefs, vague speech, and unconventional behaviors. They might even feel that totally unrelated events carry special personal meaning just for them.
So, we've explored detachment and suspicion. But what happens when the exact opposite occurs? What happens when emotional intensity and conflict completely take over a person's life?
Intense emotions and conflict. Let's look at borderline personality disorder. The defining feature here is intense emotional instability. Everyday experiences that you or I might easily brush off can feel entirely overwhelming. Moods change rapidly, and there is often a profound, intense fear of abandonment, even when there's no actual evidence that abandonment is even happening. In relationships, this means a person might quickly shift from completely idealizing someone to feeling deeply disappointed and betrayed by that very same person. It is a wildly intense emotional roller coaster.
Antisocial personality disorder is a condition that is, let's face it, heavily sensationalized by the media. But clinically speaking, this is a persistent pattern of disregarding the rights, safety, and feelings of others. It involves impulsive actions, repeated deception for personal gain, and crucially, a lack of remorse after harming others. But we have to remember, and experts really emphasize this is a complex condition born from a mix of genetics, brain differences, and often severe childhood trauma or neglect. It usually begins in adolescence. It is absolutely not simply a matter of a person waking up and choosing to behave badly. You know, it's deeply interesting how the clinical reality reframes two conditions that are constantly misunderstood, histrionic and narcissistic personality disorders. We always hear the stereotypes, right? The attention seekers or the arrogant narcissists. But look at the underlying drivers here. Histrionic PD does involve excessive emotional expression to remain the center of attention, but it stems from deeply rooted emotional needs developed over many years, not just vanity. Similarly, while someone with narcissistic PD might appear highly confident and expect special treatment, that outward image is actually covering up a surprisingly fragile self-esteem that is completely dependent on external admiration. To them, criticism feels deeply, deeply threatening.
Understanding the vulnerable emotional needs beneath those behaviors totally changes our entire perspective, doesn't it? Which leads us to our next major question. What happens when an overwhelming sense of fear dictates the relationships we choose?
Driven by fear and needs.
So the crucial point here is understanding the specific nature of the fear. Avoidant personality disorder isn't just shyness. This is an intense fear of criticism and humiliation that leads to severe social isolation. And what's heartbreaking is that these individuals deeply want close relationships, but they avoid them because they are convinced they will be judged or rejected. In contrast, with dependent personality disorder, the fears of separation. This leads to an excessive need to be cared for, resulting in highly submissive behavior. They might struggle to make even basic routine choices, like what to wear or how to manage their finances, without heavy reassurance from others. The need for connection becomes so extreme it completely stifles their personal growth.
The path to understanding.
Let's move to TILO and see how this builds the foundation for treatment. Because you don't just diagnose a personality disorder with a quick blood test or a brain scan. It requires a really comprehensive, detailed psychological evaluation. Professionals have to identify long-term, stable patterns. They aren't looking at isolated incidents or temporary emotional states. They are looking for deeply ingrained behaviors that have been present since early adulthood. Finally, the primary path forward is long-term psychotherapy. Whether it's building trust for someone with paranoid PD or regulating emotions for someone with borderline PD, therapy is all about gradually building healthier coping and relationship skills.
We must also clarify an absolutely crucial point. Medication is secondary. There is no magic pill that cures a personality disorder directly. Instead, medication might be utilized as part of a broader treatment plan to help manage accompanying symptoms, things like severe anxiety or depression. That makes it easier for the individual to engage in the real heavy lifting of psychotherapy. The therapy itself, and the slow, gradual building of trust and insight, is for sure the main driver of change.
I want to end this explainer with this truly powerful quote right from our source material. Understanding these conditions offers a clear picture of human behavior and helps replace misunderstanding with knowledge. Personality disorders were once viewed by many as untreatable, but modern research shows that with appropriate, consistent therapy and long-term support, substantial improvement is entirely realistic. Recovery is absolutely possible. So I'll leave you with this thought. If we stop viewing these complex behaviors simply as permanent character flaws, and instead recognize them as deeply ingrained survival patterns shaped by biology and experience, how much more compassion could we bring to our interactions with others?